Ed DiPrete is throwing his support behind senior citizens groups. He's following Massachusetts' lead with a proposal to eliminate out-of-pocket expenses for some Medicare patients. Newswatch 10's Laurel Lucas is live in our newsroom now with more on this bill and the others. DiPrete has promised to bring down the costs of health care for the elderly. Laurel.
Frank, the issue is whether middle and upper income elderly can be charged for some services under Medicare. Low-income elderly right now are protected from such charges. The issue has been debated by senior citizens groups and physicians for several years now.
Physicians in Rhode Island have a choice when their services cost more than what Medicare will pay. They can charge the patient for the difference. 92% of the time, physicians don't charge patients. But the Medicare assignment bill being sponsored by Governor DiPrete would put a stop to that option completely. Senior citizen activists have been trying to get such a bill passed for several years.
The Medicare program is an entitlement program. It's not a welfare program like Medicaid. Therefore, it should not be bound by any kind of means testing, in other words, based upon one's income.
Even with the governor's support, passage of the health bills through the General Assembly isn't certain. The head of a leading physicians group has already called DiPrete's proposal on Medicare assignment a slap in the face to Rhode Island physicians. Dr. Boyd King of the Rhode Island Medical Society says his group was working with a legislative commission on a voluntary means of eliminating the problem.
It's a coercive atmosphere where it's not necessary, in my opinion. And that's what we resent, because we're proud of our compliance rate, and it's simply unnecessary to do.
DiPrete is also proposing that the elderly receive up to $500 a year for homemaker services if ordered by a physician. A third bill would expand the kinds of medication that can be reimbursed by the state through the Pharmaceutical Assistance Program.
DiPrete also announced the formation of a commission on Alzheimer's disease. The commission would study the scope of the problem, the Alzheimer's problem in Rhode Island, and what needs to be done to help those afflicted. Frank?
All right, Laurel, thank you. A federal judge today denied a request for a temporary restraining order in the case of a Woonsocket couple